Welcome back, our fans. The following were identified as PMDs by the WHO. Working Group on Oral Cancer. A. Leukoplakia. B. Erythroplakia. C. Palatal lesion of reverse cigar smoking. D. Oral lichen planus. E. Oral submucous fibrosis. F. Discoid lupus erythematosus. G. Actinic keratosis. Warning signs. A poorer prognosis is suggested by surface nodularity, erythema, ulceration, increased firmness and induration, unexplained hemorrhage. 2. Biopsy. Biopsy and histopathological assessment are the gold standard of OSSC diagnosis. 3. Brush biopsy. It is non-invasive screening technique. The brush biopsy uses a small nylon brush to gather cytology samples, then sent for computer scanning and analysis to identify and display individual cells. Oral brush biopsy. 4. Vital stains. A major problem is to ensure that the biopsy is taken from the area most likely to contain the greatest number of cellular changes suggestive of premalignancy or malignancy. Vital staining may facilitate this. Toluidine blue, also known as toluenium chloride, staining. It is a simple and inexpensive diagnostic tool. It is a basic metachromatic nuclear stain, concentrated in cells with abundant nucleic acids. It stains nuclear material of malignant and potentially malignant lesions but not normal mucosa. Toluidine blue. Steps. L. The patient rinses the mouth with 1% acetic acid for 20 seconds, followed by a similar rinse with water twice for 20 seconds. 2. Rinsing the mouth with 1% toluidine blue solution for 60 seconds. 3. Rinsing with 1% acetic acid solution for about L minute, followed by a water rinse. 4. Clinical appearance of a dark royal blue stain may be significantly related to the nuclear uptake of toluidine blue, and pale royal blue staining may be unrelated to any histological feature. Advantage: high sensitivity for detecting carcinoma. Disadvantage: false positive dye retention may occur in inflammatory and ulcerative lesions. V. Light-based detection systems, optical systems. The light-based oral cancer diagnostic aids operate on the assumption that the structural and metabolic changes that take place in the mucosa during carcinogenesis lead to changes in the absorption and refraction behavior of tissues when exposed to different types of light or energy. They have been developed with the aim of assisting clinicians in 1. Identifying malignant and premalignant lesions. 2. Identifying cellular and molecular abnormalities not visible to the naked eye on routine examination. 3. Selecting biopsy site and enhancing visibility of surface texture and margins of lesions. The disadvantages of these technologies are being expensive and time-consuming. The most common methods employed by these aids include chemiluminescence, tissue fluorescence imaging, tissue fluorescence spectroscopy. A chemiluminescence, reflective tissue fluorescence, concept refers to the emission of light during a chemical reaction. Theoretically, abnormal cells have a higher nuclear to cytoplasmic ratio and reflect the light to appear distinctly white, or acido-white with brighter, sharper, and more distinct margins, compared to normal cells that absorb the light and appear blue. Available systems and techniques. Visi Light System, Zila Pharmaceuticals, Phoenix, Oz, USA. The system involves an oral rinse with a 1% acetic acid solution for 1 minute to remove the glycoprotein layer and partially result in mild cellular dehydration, thus refining the visibility of the nuclei. A handheld device emitting blue/white light of 490-510 nanometers in wavelength is then used to examine the oral tissues. Normal epithelium appears lightly bluish while abnormal epithelium appears distinctly white, acido-white. Advantages of Visi Light. 1. The high reported sensitivity in many studies. 2. Non-invasive. Disadvantages. L. specificities are significantly low. To reduce the number of false positives, the system has recently been combined with toluidine blue stain. 2. They are not able to differentiate dysplasia/carcinoma from benign lesions. 3. Sometimes, make visualization more difficult because of distracting highlights on the oral mucosa. B. Tissue autofluorescence, narrow emission tissue fluorescence, concept fluorophores plus ultraviolet light autofluorescence idea. Behind tissue autofluorescence is that changes in epithelial cell structure, e.g. hyperchromatism, increased cellular/nuclear polymorphism, and metabolism, e.g. concentration of flavonoidenine dinucleotide, and nicotinamide adenine dinucleotide, as well as changes in the subepithelial stroma, e.g. composition of collagen matrix and elastin, change the interaction of oral mucosa with light. Specifically, these epithelial and stromal changes can alter the distribution of tissue fluorophores and their ability to emit fluorescence after stimulation with an intense light. Available systems and techniques. The scope. Registered, Visually Enhanced Lesion Scope, LED Dental Incorporated, White Rock, British Columbia, Canada. The device works by emitting a cone of light in the blue spectrum, 400 plus 460 nanometer, into the oral cavity, causing fluorophores in the oral tissue to elicit and fluoresce. The fluorescence can then be viewed directly through a selective, narrow band filter embedded within the instrument. Normal mucosa emits a pale green autofluorescence, whereas areas suspicious for epithelial dysplasia or SCC produce decreased levels of autofluorescence and appear darker compared to the surrounding healthy tissue. Advantage: high reported sensitivity and specificity in early studies. Non-invasive. Disadvantages: false negative findings may cause clinicians to overlook premalignant or malignant lesions, and false positive findings could lead to undue patient anxiety and increased healthcare costs. 2. Loss of autofluorescence is not only limited to epithelial abnormalities but can also occur with prominent surface vascularity, including areas of inflammation and hyperpigmentation. 3. Interpretation of results requires skill and training, making it best suited for oral medicine specialists. Saliva-based oral cancer diagnostics. The saliva is an easily available pool, in direct contact with oral cancer. So it provides a non-invasive tool for oral cancer diagnosis. 1. DNA ploidy quantification of nuclear DNA content. DNA ploidy is the measurement of nuclear DNA content that provides a measurement of chromosomal alterations characteristic for malignant cells. 2. Tumor markers and biomarkers. Tumor markers may be present in blood circulation, body fluids, cell membranes and cell cytoplasm when released by cancer cells or produced by the host in response to cancerous substances. P53, VEGF, Ki67, BAX. VLE PET scan. Positron emission tomography, PET, is a useful tool in preoperative staging of cancer patients. It shows good accuracy and predictive value in determining lymph node status and thus helping in screening and early diagnosis of oral cancer in affected patients. Thanks for watching. Support us by likes and subscribes.